November marks Lung Cancer Awareness Month. It's a time to highlight the importance of early detection and prevention. And today we're joined by Dr. Anuja Vyas, Chief of Pulmonary Medicine and Critical Care with Sharp Steely. Doctor, thank you for being with us today.
Thank you so much for having me.
Yes,
it's a pleasure.
Of course, important discussion to have. Let's first start with the work you've been doing for lung cancer prevention.
So I'm very proud of the work that we do at Sharp Steely. Myself, along with my team, what we do is we screen all patients for early lung cancer detection. So we have two parts to that. We actually, if you're a Sharp Steely patient and you go to any Sharp hospital or emergency room and you get a CAT scan, we follow any spots that are seen on the CAT scan without you even knowing on the back end and make sure you get appropriate follow-up.
No matter what you go in for.
No matter what you go in for, because guess what? 40% of lung scans have spots on them.
Wow.
40%. And not all of them are cancers. In fact, most of them are not, but they do deserve appropriate follow-up. So what we do is we make sure that these are followed up, your primary care doctor knows, you know, and you're taking good care of them.
Okay, so these spots on the lungs, of course, early detection, such a critical part of all this. When it comes to people who maybe don't smoke, they might think, I'm fine, I don't need to worry about it. Tell us the truth here.
Right. So you're totally right. That's a great question because smoking is the most common reason why people get lung cancer. However, 1 in 5 patients who get lung cancer has never smoked in their life.
1 in 5, okay, non-smokers.
So it's important to make sure that everything that you see is followed up. It may be nothing, but just be safe.
Would that be related to just pollution in the air, or what could it be?
So pollution in the air, genetics make a difference, and long-term exposure to secondhand smoking plays a big role.
Okay, what about marijuana and vaping? Obviously, that's grown in popularity over the years. How would that increase possibly chances?
And so great point, because marijuana has been around for a long time. It comes in many different products, many different styles, and some of these products do have these chemicals that can cause cancer, but the research isn't conclusive yet. Same with the vape pens. The vape pens heat up chemicals, and then you inhale them. So over decades, we may see more incidents related to vape pens, but it's hard to know right now. As a lung doctor, as a friendly neighborhood lung doctor, I would say don't inhale anything that's not fresh air or prescription inhaler.
I know when you say you're heating up chemicals, putting that in your lungs, it can't be good for you.
It can't be good for you long term.
Okay, good to think about. Are there symptoms that might be, a sign of possible lung cancer?
Absolutely. So lung cancer is best diagnosed way before you have symptoms, right? However, if you have a cough that's lingering and not going away, if you're losing weight that's not explained otherwise, if you're coughing up blood and just having any of these symptoms, this is the time to reach out to your doctor and advocate for yourself and make sure you get tested.
Okay, let's talk about the screening. Who should get screened? How is the process done?
Yeah, and this is the biggest question that I get because there's a lot of uncertainty and patients are like, well, I don't know, I don't want to go through painful tests. But lung cancer screening is done by a low-dose CAT scan that's actually a quarter of the radiation of a regular CAT scan, so very low dose. It is painless. It can be done at a lot of different places, and it's most often covered by insurance.
Okay.
So
no matter what age or what you suggest.
So, and that's a great point, right? Because so if you have smoked for more than 20 pack years, if you're a current smoker or you've quit recently in the past 15 years, and you're within the age of 50 and 80, you should definitely reach out to your doctor to complete screening. Okay,
so if you're listening right now, you fall in that category there.
Right.
Reach out, you can get the scan.
Exactly. So more than 20 pack years, with currently smoking or quit within 15 years, and between the ages of 50 and 80.
Okay, and for anyone that has it in their family, is this also something to keep in mind?
This is a unique category, so definitely worth a discussion because even a one-time scan may be very helpful in these patients.
Doctor, thank you very much. Where can we go to learn more?
So the best place to go, sharp.com. We have a lot of information and saved by the scan. So that's what you want to remember.
Saved by the scans. Appreciate your time today.
Thank you so much.
You're busy out there at the hospital, so thank you for coming in.